Okay. Dr. Ramani, mic. Okay, Assalamualaikum warahmatullahi wabarakatuh, and a very good evening to everyone, to all the viewers. So for tonight, we have another session, which is I think a good initiative by HUD, which is an NGO, which is actually called Health and Empowerment Reform Team. Okay, so there are several series of specialist program introduction before. So tonight is the turn for sports medicine, which is Road to Sports Physician. So Dr. Ramani, what happened? Okay, so basically today we are having two young and enthusiastic specialist sports physician with us. So I'd like to start with a brief introduction by Dr. Ramani. Maybe you have some brief introduction.
Okay, Assalamualaikum and good evening. I'm Dr. Muhammad Rahmani Jaafar, sport medicine specialist from University of Malaya Medical Center. Graduated in Master of Sports Medicine in 2015, and now already being a sports medicine physician for about almost 5 years. Okay, short introduction.
Okay. Okay. So Dr. Malini can brief yourself.
Okay. Thanks, Hazwan. Hi everyone. I'm Dr. Malini Karupaya. I'm currently a sports physician practicing at Hospital Serdang. This is currently my 3rd year as a specialist, and I was in University Malaya, and Dr. Ramani was my senior, and of course Hazwan was my junior. So it's a great pleasure to actually to be live with Ramani as well as Hazwan. So thank you for the opportunity to HUD as well.
Okay, so I guess without further ado, we start with the first question. So Dr. Ramani, I think sports medicine is actually quite sometimes already. I think we already established since 1998, but I guess not many of young doctors are actually aware about the program called sports medicine specialties. Okay. So can you brief a bit about background of sports medicine and then the services that available in UMMC, the place where you practice now?
Okay, very good question. Organizer Fatin, please open up the slides. I have a few slides to show. Okay, before that, actually, sports medicine in Malaysia initiated the first slide. Initiated in 1998 as a conjunction, if you all still remember Kuala Lumpur 98 Commonwealth Game. So our country won the bid. So in the wake of Malaysia's successful bid as Commonwealth Games host, it is a professional requirement for the country to host Commonwealth Game or Olympic Games, the professional level, to have sports medicine physician in the country, sport medicine services in the country. So what's the function of the unit at that time? As a referral center, providing services, providing ongoing research that is pertinent to Malaysian athletes and will directly contribute towards the development of sporting excellences in the nation. And it was originally Special Sports Medicine Center of referral in 1998 Commonwealth Games, where we have still have in PPUM now, in UMMC, where we call it Commonwealth Green Lane. Now, if you all come to PPUM, the orthopedic clinic is actually the Commonwealth Green Lane in 1998. So already 22 years has been established in Malaysia. Next slide, Fatin. Okay, this is my workplace, University Malaya Medical Center. Next slide. Okay, what's the vision of sport medicine set up that time? To be the centers of excellence which will provide leadership, training, research, development. Where's my slide? Where's my slide? Okay, training, research and development, and the provision of service in the domain of medicine, health and research. Okay, next slide. Next, we want to know what's the mission of setting up the sport medicine services that time to improve the understanding and quality of sports medicine in Malaysia, providing medical treatment for injuries and illness, provide medical examination before starting to spot, to detect and damage that could be worsened by sport, to provide medical performance investigation regarding heart circulation, respiration, metabolism. This very organizational proposals or mission, but I will tell myself experience why I chose sports medicine as my career. Okay, next slide. Okay, sorry, this is very busy slide here. Actually, in UM particularly, we have two major domain of sport medicine services, which is first is sports medicine, injury prevention and management, or known also musculoskeletal medicine. The other domain is fitness and exercise medicine. So we have two domain services in UMMC particularly. So for sports medicine part or musculoskeletal part, the services are referrals for sports and musculoskeletal related injury, screening for elite athletes, sports and recreational activities, advice on healthy lifestyle, exercise prescription, and so on. Providing sports medical care coverage for sports, even minor or major competitions, and referral center from. We receive referrals from various entities such as ISN, university sports centers, not only UM but various universities in Malaysia, Kuala Lumpur Sport Council, football clubs and academy, and many more, especially GPs or other hospitals as well. Okay, next slide, Fatin. Okay, musculoskeletal management per se is the early detection, treatment, and prevention of and rehab of sports and MSK injuries related to muscle, joint, tendon, cartilage, not just soft tissue. When you enter sports medicine, there is no more soft tissue because we need to identify what is soft tissue that related to the injury. So pre-sport screening for elite and recreational athletes, and also we give ergogenic drugs and doping consultation and medical protection services, as I mentioned, coverage. Next slide. We want to know the larger domain of services in sports medicine. Actually, okay, first and foremost, if you want to enter or interested in doing sports medicine as your career, don't put that you want to be a sport physician because you want to cover the games, because you want to go to Olympic Games, because you want to be the Manchester United physician or whatsoever, because sport medicine is very, very large area. This is a second domain in UMMC per se, where we have fitness and exercise medicine services. We do exercise prescription for various medical underlying problems such as arthritis, diabetes, heart disease, childhood obesity, PCOS patient, and also we do fitness assessments such as BIA, if we have ever heard about bioimpedance analysis, VO2 max testing, isokinetic testing, weight management consultation, healthy dietary consultation, and many more. Okay, next slide. Okay, I think this is MEDEX will be elaborated by Dr. Malini later.
Okay, thanks Dr. Ramani for a very comprehensive explanation on sports medicine service and history, which is very interesting. It's a pleasure to work with him in UMMC. So next question to Dr. Malini. So Dr. Malini is a sports physician working in Serdang Hospital. So can you give a brief on how the services in Ministry of Health Hospital?
Okay, Hazwan. Currently in Serdang Hospital, as you all know, it's a KKM, Ministry of Health. So we have about 40 sports physicians, and in Serdang, where I'm currently practicing, I have 3 of us. So what is basically our main gist of work? It involves MSK, musculoskeletal injuries. That means we deal very closely with the sports surgeons, because we come under orthopedics and traumatology department in Hospital Serdang. So we have various surgeons, not just sports surgeons, but we also have the spine team, the hand, the foot and ankle. So what we normally do is we work based on the pre-rehabilitation as well as the post-rehabilitation. So those who are injured or those who have any kind of MSK injuries, normally the surgeons, they will do refer to us. So we can manage them pre-rehab as well as post-rehab after their surgical. And for example, one of the common injuries in Hospital Serdang, because we work closely with sports surgeons, obviously we have ligamental injuries, whether it's isolated like ACL injuries or even multi-lig, such as ACL, PCL, even the lateral collateral ligaments and involvement, and of course the meniscus. And besides that, since we are based in MOH, we don't only treat athletes. For example, like like we call them like weekend warriors, those who are recreational athletes, but also a lot of laymen where it doesn't mean they sustain through athlete or even a sports injury. But for example, like what Dr. Ramani mentioned earlier, even arthritis itself, even sometimes we come across like just not a plain simple arthritis, but something more regarding about rheumatoid arthritis, or whether any kind of autoimmune diseases involvement, where we have to refer to the respective departments. And of course, based on that, we also have other injuries such as the foot and ankle. We have the hand team, and also a lot of other injuries where they are referring to us. And of course, we also have obesity. Okay, obesity, as you all know, is a huge matter, especially in Asia, especially in our country as well, because due of diabetes and hypertension and everything. So therefore, a lot of them do. And currently now, the primary health team, especially those who are based in Klinik Kesihatan, the family medicine specialists, as well as the MOs, medical officers, they refer to us for exercise prescription. So basically, we prescribe an exercise for those who are obesity, even diabetes. And recently, I had the privilege to go and give a talk to the primary health team in PKD Hulu Langat, which is based in Selangor. And they were very intrigued because a lot of them have this misconception about where exercise and rehabilitation is only about rehab physicians. So at least it's kind of like an eye-opener, the fact that we are sports physician, we're also involved in exercise prescription, even rehabilitation, whether it's pre or post, and just not about MSK injury, but it's also a lot of involvement of obesity as well as NCD diseases. And if Fatin, if you don't mind, I would just like to talk about the MEDEX slides. If you can put that up.
Will be asked. I think MEDEX will be asked in next question.
Okay, sure. All right.
Okay. So I guess based on both panelists, what they mentioned just now, in a way, actually, sports medicine is actually is part of the multidisciplinary team. I think in KKM, they work very close with sports orthopedic, which is a good advantage that they can see a lot of post-operative rehabilitation. While in UMMC, we also have the same chance. But I mean, I would like to ask an extra question to both panel actually. How do the services differ in KKM and in UMMC? Any difference or in terms of services available, or is it the same as others? Maybe Dr. Ramani can answer.
Okay, there's a bit different between services, sport medicine services in UMMC and KKM because in UM, sport medicine stands on its own. So we are independent department in UM, but in KKM, sport medicine still under orthopedic. So the services, the budget allocation, everything definitely different. So I would say in UM we are more independent and free to give services. That's why we focus more on musculoskeletal related and also exercise prescription. Because in UM, the post-op rehabilitation, post-op patients specifically organized or managed by sports orthopedic team. So they, in UM we have a special sports team and special physiotherapy and rehab team for post-op. So that's a difference between UM and KKM sport medicine services. But originally we are trained in the same way. Okay.
Dr. Malini, any opinion on that?
Yeah, it's exactly what Dr. Ramani has explained. Like in KKM, sports medicine, we don't have a unit yet. We currently our head of service, Dr. Rozaman, is trying to work towards that. Trying to get us to be an independent unit. For example, like rehabilitation, they have their own department. So we're working towards that. That is our way forward currently, and hopefully in the future we might get a unit. So we are based in the orthopedic department in most of the KKM hospitals. So we work very closely with the orthopedic team. So we have a lot of surgeons, but like you said earlier, it's a multidisciplinary approach. So any department in a hospital where they have any kind of cases regarding about not just like I said, the sports injury, but anything related to us, they are more than welcome to refer to the MOH sports physicians. So like I said, even not just in hospital, but even at primary health centers, especially about exercise prescription, obesity. And so we are getting a lot of referrals currently. And so yeah, that's one of the ways that you can look into it, where in UM, they're more independent because they have their own unit. And like in KKM, we come under Jabatan Orthopedic and the trauma team. So obviously our budget and everything based on the orthopedic department. But nevertheless, it's still, being looked upon as one of the very important specialty, and it gives a lot of importance, especially to the surgeons, because they sort of like see us as a complementary team towards them, because it sort of like helps them with their patient load as well.
Okay, thank you, Dr. Malini. So I guess sports medicine have a very bright future. I think hopefully KKM will the ambition to have an own unit will be met soon. Okay, so next question to Dr. Rahmani. I think every year we have, I heard there's a lot of applicants keep increasing every year. So do you like to explain about the entrance exam or basic requirement for application in sports medicine program?
Okay, it's a good question. I think I've been waiting by all audience listeners tonight. So Fatin, please share my screen. Okay, do you know that when I applied sport medicine in 2011, there were only about 20 applicants that time. So we were invited and called upon for the interviews. Then out of 20, only 6 selected that time. Recently, since the past few years, do you know how many applicants that applying to go in sports medicine? It's about 70 to 80 applicants, where the seats allocated that we can provide based on lecturer to student ratio in UM, only 10 to 12 seats maximum. That's all depends on KKM and non-KKM. They want to send how many students to UM as their master candidates. So first and foremost, of course, you have to go through nowadays the medical specialist pre-entrance examination. I think 2020 candidates are the pioneer for MEDEX exam because government or university want to centralize all the application to enter the master program. I think MEDEX exam will be elaborated clearly by Dr. Malini later on. Next slide, Fatin. Okay, alamak, so small. Can you go to next slide? Okay, next slide. Okay, this is a requirement, the general requirement as for applicants to apply sports medicine. Generally, you have MBBS or MD, and university need only 1 year experience to enter the master program. But I think requirement nowadays from KKM have to be 2 years of housemanship and 1 year of junior MO, if I'm not mistaken, the latest. Other than that, you have to be recommended by current head of department, have documentation, proper documentation, and recommendation from head of department or current supervisor. Other than that, go through the MEDEX examination, and those who pass the MEDEX examination will be called for OSCE or interview in UM. So out of, as I mentioned, out of 70 to 80 applicants, usually about 50 to 60% pass the MEDEX exam. Then we will call them for OSCE or interview in UM. Okay, a lot of question to me, what to study to sit for the MEDEX exam in OSCE or entrance exam for sport medicine. Can you go back to previous slide, Fatih? Okay, this actually outline of throughout the 4 years of master program in sports medicine. What you need to know is the phase 1 only, because phase 2 is already more to clinical and preparing to be a specialist. But generally, what you need to know before entering sports medicine, if the slides, is all about basic science but applied. What's the meaning of applied? If you know the anatomy of ankle, if you know anatomy of the knee, it's not enough, because it's applied. It's more than that. It's more to biomechanics. It's more to velocity, forces of injury, and more detail about that. Also, physiology is applied physiology. It's not just basic physiology, but the question that come out in the MEDEX exam or OSCE or during the interview is more to apply basic science. So what you need to know, basic science that related to exercise. For example, the question that have been come up, for example, what cancer that related to sunlight? Because we know that nowadays people doing exercise under the sunlight during the hot temperature, hot weather all. So what cancer that related to this hot? So this kind of basic science question will be come out in the MEDEX exam, and also OSCE or interview later on. Okay, can you go to next slide? Next slide, Fatin.
Okay, next question.
I think next question. Okay. Back to Dr. Malini.
Okay, Dr. Malini. Okay, so far the only pathway that KKM candidate can apply is actually through HLP. So I think for the past few years, HLP have changed a lot of things. You have 3 completed SKT and a lot of new changes that you must have. You must pass the first filtration, the second filtration. A lot of things have changed now. So can you enlighten on us on the latest HLP requirement for applying sports medicine?
Okay, the latest HLP requirement, because recently we had a KKM meeting in Selayang with our head of service and with all the other sport physicians. So when we did ask our head of service what is the latest HLP, because we are getting a lot of questions. Even while working in Hospital Serdang, a lot of housemen are interested, a lot of medical officers are interested. So they're coming in, you know, they want to know exactly, and they want to secure their seat when they apply, because as they know that, you know, like what Dr. Ramani mentioned, is about 70, 80, almost 90 are applying. And there's only about 6 seats which is available. So obviously the competition is really back to back, and everybody wants to secure the seat. So they want to know exactly how to go about, are they in the right pathway, are they in the right department, or should they go and do a district posting? So one of the things that were brought up and was also mentioned, the fact that if it will be like a plus point if they were to work either in a primary healthcare, for example, like Klinik Kesihatan, or even a district hospital, all right? And then the second one, if they were in an orthopedic department, okay? Third one, if they were in a medical department, and as well, also if they were in an emergency department. Because what they feel is, because it's a multidisciplinary approach, so the candidate should be able to manage a lot of different kind of multidisciplinary. For example, if you're in an ED, when you're based in a green zone, yellow zone, red zone, so you're able to filter, and you're sort of like having this thinking cap in how to manage patient in all kind of box. Because whoever comes to green zone, as you all know, it's more like the cold cases. Yellow zone is the intermediate, and red zone is where you get all the difficulty cases and everything, and where there's intubation, everything is involved. So that's why ED is one of the main departments. It'll be like a plus point. And if you're in an orthopedics department, okay, orthopedics and traumatology, it really helps as well. Medical, because medical, obviously, you're going to see a lot of cases regarding about whether it's even like, for example, if you get a pneumothorax case, how to manage it. If you get a patient who collapse, how do you resuscitate the patient and everything. And of course, bring in a primary healthcare, whether in a clinic kesihatan or in the district hospital, you are basically sort of like have to be self-sufficient because you have to manage. And in case, in the view of you're unable to manage it, obviously you're going to call to the tertiary hospitals, to the consultant or specialist, or even a medical on call on how to manage. So it sort of gives you like a sense of independency. So that is why KKM has said that the plus point as a medical officer, if you are in these particular departments, it will sort of like give you an extra mark if you were to apply. And of course, the HLP, the requirement is 3 years as a doctor, 2 years as houseman, and 1 year of a medical officer. And as you all know, MEDEX has been implemented. Okay, what is the short form for MEDEX? A lot of frequently asked this one. Fatin, you don't mind, can you just put up the slides for MEDEX? All right, next slide, please. Yeah. So what is MEDEX? Okay, MEDEX is short for the Medical Specialist Pre-Entrance Examination. All right. So basically, it's a peperiksaan pra kemasukan ijazah lanjutan perubatan in bahasa. So basically, it's established by the Medical Dean Council of Malaysia and conducted by the Malaysian Examination Council. All right. And this is served as one of the screening criteria. Okay. So it's a criteria to select a good candidate to join the clinical specialist training program. As you all know, there is 14 specialty in Malaysia to apply for this MEDEX examination. Next slide, please. Okay, so how often is the MEDEX being held, if one were to ask? Okay, it's for now conducted once a year, but they are planning to increase at least twice a year in the future. All right, so next slide, please. Okay, so if a houseman or MO to ask me, if I pass the MEDEX, will I be guaranteed a place in the clinical specialist training program? So basically, your MEDEX result is one of the requirements to join the clinical specialty. But however, there are other selection criteria to be fulfilled before you. So like I said, they have to look into, as you know, the competition is really back-to-back now. So there's a lot of candidates coming in with being in a certain department like Auto, whether they're ED, whether in tertiary, or whether in a district posting. All right. And of course, some of them are coming also with publications. Okay. If you would have publication or some kind of study done and everything, obviously that's a plus point as well. Okay. And if you were to be even done a small attachment in a sports medicine, that might be a bit of a extra advantage. But what we've discussed recently is the biggest advantage if you were based in one of the departments where you are sort of like the main person involving in the management, for example, auto, medical, and also in the district posting. All right. So as you can see, it can be embedded into the program, but for further details for each program, the selection criteria has to be assessed. Fatin, next slide, please. Okay, how is the MEDEX results expressed? Okay, so there's something called, it's not given pass or fail, but it's something called BAND, B-A-N-D, okay? So it's from 1 to 6. And the recent KKM meeting, the criteria which has been set is about band 4, all right? But some of them obviously they're saying because the competition is so stiff, they sometimes would like to take the cream of the cream and they're trying to sort of like bring it to band 5. But for now, they feel that they need to have a bell curve, all right? So they want to stick to band 4, and based in that particular bell curve, they will do the selection, okay? So we have the KKM representative, which will be the HOS, or whoever the senior consultant will be there, as well as from the University of Malaya. They will be there and they will go through the selection. So basically, based on the MEDEX exam, which is at the moment it's about band 4, okay? And of course, based on that, you have to go for the next part, which is the OSCE, as well as the interview session. All right. Next slide, please. So the next slide, we say, do I have to pay for the next stage in a selection? So for example, as you all know, per MEDEX exam is RM 800 ringgit. Okay, so it's a big amount. It's a big amount for, especially for those even a houseman or even a medical officer. So normally the MEDEX exam will last for 3 years. For now, it's being used for 3 years. So let's say if you sit for the MEDEX exam, but you're unqualified to enter the master's program, but you're allowed to use that particular result for the next 3 years. All right. So OSCE and interview is the second sort of like the second stage after your MEDEX exam. And like I said, RM 800 per exam. Next slide, please, Fatin. All right. So, HO might ask, okay, I'm a house officer. Can I sit for a medic exam? Yes. Anyone can basically sit. As long as you're a qualified doctor, you can sit for the exam. But of course, it's a certain selection criteria based on your whether your head of department is going to allow you, or based on your posting and everything. So a lot of additional prerequisite might have to be looked into upon. And next slide, please. All right. Is there a limit to how many times can I sit for MEDEX exam? No, there's no limit at all. As for if anyone were to inquire about this, whether the houseman or medical officer, there's no limit. And if I were to do well in MEDEX, will I be automatically qualified for the training? So, for example, like scholarships, like as you all know, we call it HLP, Hadiah Latihan Persekutuan. All right. So HLP or any other training scholarship is managed by the sponsor. All right. So it's based on a sponsor whether they do want to, according to their terms and conditions. So you have to check whether if you're HLP, whether you're not HLP, whether you apply as a private candidate, all that based on the sponsorship as well. Next slide, Fatin. All right. So is MEDEX limited to Malaysian citizens only? No. Foreign citizens can also sit for the MEDEX as preparation for the entry into the master's program. So Malaysian Medical Specialist Program, for further, as you all know, you have to look obviously to the prerequisite, but basically not just Malaysians, but non-Malaysians, foreigners are allowed to sit for the MEDEX exam. All right. Okay.
Okay, thanks, Dr. Malini, for very comprehensive explanation on MEDEX. So I guess now the competition getting more stiff, and then it's getting more difficult to come in. There's a lot more requirement that you must fulfill before you can get in. So they have to go through the MEDEX, and then there's another interview by sports medicine, right? Or OSCE. Yes. Different, yeah. That one is different session, right?
Yeah, that's like a stage 2, like that.
2 stages, okay. Yeah. Okay. So the question to Dr. Rahmani. So other than HLP pathway, is there any other pathway for anyone to get into sports medicine program?
Come again, the question?
The other pathway of getting in sports medicine other than HLP.
You mean non-KKM, is it?
Yes, non-KKM.
All right, it's a good, interesting question, and many candidates that trying to apply or from we call it private, but it's not private hospital, but private means non-KKM, because majority of master candidates in Malaysia are sponsored by KKM because it involves a huge amount and time, 4 years, 5 years, involving thousands or hundred thousands of ringgit. So mainly sponsored by KKM. But there are non-KKM pathway that you can try to join sports medicine. First, that we have case, very interesting case this year. He has MRCP Part 1. Okay, he has MRCP Part 1. So because last year still MEDEX still not still applicable, so this candidate have MRCP Part 1. So he entered sports medicine, passed the OSCE and interview, and he exempted to take the Part 1 exam of the master. This is very interesting. Okay, if you have an MRCP or FRCS, for example, you have a privilege or advantage to be selected to go into the master program, but you still have to go through the OSCE and interviews as well. Other than that, you can apply to universities. Currently, we have universities that are sponsoring doctors to pursue master. For example, UM as a SLAB candidates. Now we have a candidate from UIA, USIM, and in the future maybe we will have UKM, UITM candidates that, or even UPNM, the Defence University, that will send their candidates to enter sports medicine program. Other than that, ISN, for example, if you apply ISN, you're selected to be their medical officer, then you have privilege and opportunity to pursue master as well. Other than that, we have previously from Defence Ministry, from Hospital Sultan Mizan, from what other hospital under Defence Ministry. So there are many ways pathway other than KKM pathway. We also have previously master candidate from hospital, from private hospitals, Pantai Hospital, and even GP that applied. And other than that, starting this year, we will have international students. Interestingly, we will start opening to international students as well. Okay, I think hope answering the question.
Okay, interesting. So just to mention that there are actually several pathways of going into sports medicine. If you are from KKM, obviously HLP is one of the way. So if you want to resign and join another ministry, so maybe you can join Ministry of Defence, Ministry of KBS, or Ministry of Education as a SLAP candidate. So there's a lot of pathway to consider. Okay, Dr. Malini. So since you mentioned about a lot of requirement and preparation need to be made, so any tips for preparation for exam?
Okay, like the MEDEX exam, like what Dr. Ramani mentioned earlier, is about applied basic sciences. So when I sat for my entrance exam, obviously when I did consult the seniors and everything, it was a very wide area of topics which they cover. All right. So basically, if you have a good basic science foundation, and obviously I did use books like even MRCP Part 1 or even MRCS Part 1. Basic sciences book for medical school and everything like that, sort of like to brush up. You know, after once you've been working after some time, obviously being a normal human being, you're going to tend to forget about your basic sciences. So you have to really brush up on that. All right, even your applied, and like I said, like applied anatomy, even the surface anatomy is very important because it's not very directly just about anatomy per se. But your surface anatomy, surface marking, everything, because that's exactly what you're going to be, sort of like be dealing with in the future if you're get accepted into the master's program. And of course, your physiology, not just the basic foundation of physiology, but once you do the master's program, it's more towards the exercise physiology. And if you were to have a background of even doing something like a very simple certificate of nutrition or even personal training, you know, they have a lot of now academy or even courses and companies which gives you a lot of certificates based on nutrition, based on strength and conditioning, based on personal trainer. So it's like I said, any kind of knowledge is not a waste. Everything is sort of like just going to help you and enhance you towards the direction. And once you have that passion and everything, it just sort of like gives you a better confidence, because with knowledge it comes with confidence. Because once you have that knowledge, that's something sort of like gives you a confidence to sort of like pursue the exam. And nothing is right or wrong, but we just want to stir everyone into the right direction. Like I said, being in the respective departments, not just your rotation in housemanship, but once you finish a housemanship in medical officer, if you're based in a medical posting, or even the orthopedic, or even the district posting, you know. And I feel like a district posting sometimes, I think that's where you learn a lot, because you're sort of like thrown on your own, and you sort of have to deal with it. So obviously, like I said, sometimes you learn from your mistakes, you learn from failures and everything. So it just makes you a sort of a better doctor, a better candidate. And all this should be like a good experience, and gives you, because once you practice something, it sort of like becomes like an autopilot, and you tend to remember it. Because sometimes when you just tend to read just from the books, it becomes very monotonous. So it becomes very monotony. So it's good sometimes to have the experience to do all this. Even for example, I would definitely ask any candidates to go for basic life support, even for advanced trauma life support. okay, even a cardiac life support, because all this sort of like helps you to be a better candidate and sort of like propel you towards the right direction as a sport physician, because we deal with a lot of not just very basic direct, but a lot of even acute cases or even chronic cases. You have someone who collapses in front of you. It's good to have those kind of background, and sort of you update yourself with this kind of knowledge. Yeah.
Okay, thanks, Dr. Malini, for the tips. So, Dr. Ramani, any tips to share to the future sports physician that with us tonight?
Okay, I want to share what why I chose sports medicine as my career. So during the MBBS and housemanship, I was thinking why, especially Malaysia, we are the so-called champion in non-communicable disease. So we are the most obese in Southeast Asia. We have a very high incidency of hypertension, diabetes, and cardiovascular disease. So I wanted to back to the basics. So what causes all these problems? It's because prevention is always better than cure, but we are not doing well in prevention. Am I right? So in medicine per se, so prevention, where is prevention? Prevention, we can find in primary medicine. So primary medicine, because sport medicine worldwide also still not to call well established, but every countries have their own format and have their own style. For example, I want to tell you, in the US, most of sports physicians are also family medicine. In the UK, sports medicine are under community medicine. In Australia, sports medicine mostly pure sports medicine physician, or they are actually sports orthopedic surgeon. In developed country, other developed country like Japan or Korea, they are sports orthopedic surgeons. So worldwide, the sports medicine worldwide also still not standardized, and every country have their own style and format of sports medicine career. But in Malaysia, I think one of the best system of sports medicine in Malaysia, because in the only UM that offers master program in sports medicine, where we are independent department in UM. We can create and we can plan our own future and programs ourselves. So primary care is very, very important. Prevention is very, very important in medicine. So I want to reduce, I want to contribute in reduction of cardiovascular disease statistics in Malaysia. How to do it? By doing sports medicine, because we are the so-called lifestyle promoter. We can promote people, public, to have a healthy lifestyle, good nutrition, avoid sedentary and being active. All. So I think sports medicine career is the best in medicine. And other than that, I have my personal interest. Like I don't like OT, I don't like on-call, I don't like being so long in the hospital. But don't tell that sport medicine is a very enjoyable career. But although we don't have on-call in the hospital, but if we follow the athletes in sports event, we will work from 6 a.m. in the morning until 11 p.m. in the evening to take care of the athletes. And sometimes I look at one of the question on the Facebook Live just now. What is your most memorable or unforgettable experience as a sport physician? So I had encountered stop breathing athletes during boxing. Because of what? Because of the commercial cordis that cause ventricular fibrillation, ventricular tachycardia. So sports medicine is not an enjoyable career, but it is important, multidisciplinary, and should be a very important discipline and specialties in the future. Okay. Back to moderator. Thank you.
Okay, Dr. Mani, any tips to our viewers on how to prepare for exam or your personal tips?
Okay, basic science. You have to strengthen yourself in basic science. Doing your rotation now, especially related to musculoskeletal and exercise, do the rotation. Orang kata apa? Buat betul-betul lah rotation tu. Jangan main-main. Although you all work on shift, but try to find opportunity to learn basic science during your rotation, not just doing the job, pergi kerja, balik kerja, itu saja, tapi learn basic science, preparing yourself to go to enter the master program. Other than that, you yourself to be a healthy person, try to be active, try to promote people to undergo healthy lifestyle, and yourself to be an icon and an example to other people. So the doctor have to be healthy. If you are also a smoker, if you are also obese, if you are also have hypertension and diabetes, so I don't think you are right candidate to choose sports medicine as your career.
Okay, thanks, Dr. Mani, for the enlightenment. Okay, so I think we move to the Q&A session. Okay, I think we move to the Q&A session. I think today the two panelists already explained comprehensively of the requirement, all the tips, and all the background history of sports medicine. Okay, so now we move to the first question. So from Ilyasa Hilmi Ishaq, so she's asking about, currently she's taking IOC Sports Medicine Postgraduate Diploma Part 1. Will it help the future for MMed Sports Medicine application? So Dr. Mani may have answer for this. IOC diploma.
Okay. Taking the diploma, online diploma, such as from FIFA, such as from IOC, from certain universities, I would say not very, very helpful, because Malaysia have our own format and menu for doctors to enter master. For example, we have to undergo our compulsory service, we have to undergo the JPA requirements, we have to undergo the university nowadays a MEDEC examination. Although you have whatever diploma from overseas, Australia, UK, IOC, whatsoever, but you have to pass the MEDEC exam, you have to pass the university selections entrance exam as well. But it's good for you. I've been asked before, because Barcelona FC also offering their diploma and courses, if I'm not mistaken. So
yes.
by taking this Barcelona diploma in football medicine, do you have any advantage? I would say you will have some knowledge, experience that will strengthen your basic science, strengthen your confidence. Your self-confidence when you undergo the MEDEC exam, OSCE, and our interview during the entrance exam.
Okay. I hope that's answering. Okay, next question. From who? Okay, from Shamina. Shamina is actually my friend last time from Ipoh. Salam and hi. I have a question. Is there any parallel pathway for sports medicine? And there's only few seats applicable compared to other clinical course. If no, any other program can be considered. Parallel pathways. Is there any available parallel pathway of sports medicine?
Siapa nak jawab ni?
Dr. Mani still online? Maybe Dr. Mani can answer.
Okay, parallel pathway so far for sports medicine only closed system. Closed system tak ada parallel pathway lah kan. So parallel pathway is only for open system, if I'm not mistaken, like 2 years in the university, 2 years in the KKM hospital. So for the time being, until the year of 2020, we just have closed system. So you have to be 4 years in the university. So we don't have parallel system for sports medicine at the moment.
Maybe they're asking like surgical, we have MRCS.
Different.
ONG, we have MRCOG. I think so far we don't have that program yet. Okay.
Don't have.
So next question. Oh, Adnan Sulaiman. Hi doctor, do Malaysia have enough job opportunity for this course? I can see most sports organization don't focus for sports medicine. Or I just missed that. Okay. Probably Dr. Mani is the best person to answer this. He's working with a lot of athletes, a lot of teams around Klang Valley.
Well, looking at the current situation, do doctors have enough job? So for sports medicine itself, in the future, yes, definitely we will be very significant and important in the medical industry in the country, because what I mentioned just now, prevention is better than cure. We are in the primary medicine discipline, so we can contribute a very large amount to, of contribution to reduce NCD, for example, NCD statistics in Malaysia, other than we contribute to the Malaysian national athletes or recreational athlete performance. So to answer the question, I would say I would confident that we have enough job opportunity in Malaysia. Okay.
Probably he actually talking about the sports organization or athletic population, or maybe sports team that actually isn't aware of the sports medicine services. So I guess nowadays,
yes.
There's other, I think FAM, Rugby Union, they are starting to have all these sports medicine team inside. I think this emerging now.
It's our responsibility to have interest in sports medicine, to educate and create awareness among the public, among the country. What is the role of sports medicine? As I mentioned, the vision and mission of sports medicine in the beginning of my presentation.
Okay, next question from Dr. Cheng Wen Long. So where do you see yourself or the fraternity in the near future? In what area of growth can we look forward to?
Well, we have a colleague. We have senior who currently working in the best hospital in the world, which is Aspetar Doha. We have Dr. Aston working there. He was graduated in diploma of sport medicine that time 20 or 30 years ago from UK, and he worked in Malaysia for quite some time, and he applied to be sports medicine physician in Aspetar Doha, and he was selected. So that's our product as well. Other than that, we already penetrated. So I would say penetrated the private hospitals in Malaysia. We have visiting sports physician in Prince Court Hospital, in I think KPJ Hospital, Regent Rehab Hospital, Thomson Hospital. So this is an expansion and development improvement of career pathway in sports medicine. Did I answer the question?
Yeah, I think well answered. Okay, Anis Shazrina. Hi doctor, how is orthopedic different from sports medicine apart from the former being surgeons? Okay, nice question, Dr. Nawani. Different between sports physician and orthopedic surgeon.
Yeah, good question. Okay, I always tell my patient that our service is mainly non-surgical management. So whatever non-surgical management we manage. So it's like a culture or format in UMMC as well. The non-surgical indicated, clinically indicated, they can refer to our department. So we manage non-surgical, but non-surgical doesn't mean very, very conservative. We have minimally invasive interventional procedures such as joint injection, bursa injection, ultrasound guided injection, facet joint injection, and we can develop ourselves to go beyond than that. We can do epidural injection, we can do intrathecal injection, we can do what other related to minimally invasive intervention. So my area of interest as currently as a sport physician as well, I have very deep interest in interventional pain management, regenerative medicine. If we have about regenerative medicine, stem cell, PRP, prolotherapy, that's the evolution of treatment in sports medicine, where if you are in sports medicine, you know the athlete always want to fast recovery of their injury. They can't wait like normal people. They only have maximum 2 weeks of rest, for example. So our job and our roles and our responsibility to think what the best treatment, the shortest recovery that we can offer to the athletes, for example. And nowadays, many people are active. They are Ironman, they are Powerman, they are marathon runners, thousands of them. They want to perform in their performance. I mean, in their they involve, for example, involved in Powerman. They want to perform. So how to perform? Our job to educate and give them advices.
Okay, thanks, Dr. Moni. I think if you look at the statistic or prevalence of musculoskeletal injuries, in any musculoskeletal, I give example for back pain, knee pain, ankle pain, only 10 to 15% are actually operated or surgically indicated. And another 80 to 90% are actually cannot be operated. So I guess that whole bunch of problem actually belong to sports medicine. Okay, welcome Dr. Malini because it's now I have some technical problem. Okay. Oh, I have a question to Dr. Hazwan. Does your secretary training and orthopedic experience spearheaded your passion in sports medicine? Okay. Okay. Psychiatry in a certain extent, because in sports medicine we also have certain condition involving psychological problem, which is you if you want to know, there are also field of sports psychology, which is also included in our syllabus. So even though the psychiatry is under the extreme, but it still helped me a lot in terms of understanding emotional part or psychological part of sports medicine. Yeah, of course, orthopedic experiences give me a lot of advantage in practicing sports medicine because we understand another spectrum of management. I think it's good. It's a good experience when I was in Ipoh practicing in orthopedic. Okay, next question for panelists. Thanks, Ami, for the question. Okay, Aizat. Aizat Azam, I think medical officer from Hospital Banting. Many confuse sports medicine and rehab medicine. So what are the difference between these both courses? Dr. Malini, can answer?
Hi Aizat. All right. Okay, it is like I said earlier, everybody confused because it's sort of like an interlink. Okay, there's a lot of overlapping maybe, but like I said, our specialty is a multidisciplinary approach. A lot of it is based on MSK, and currently even rehabilitation is sort of like trying to encroach into MSK, into pain interventional and everything. There are sports physicians. We are more towards diagnostic ultrasound guided injections, and rehabilitation physician. Currently, even though they're not doing much of that, but they are sort of encroaching into that. So I would say like sports medicine, not just about sports as in athletes and everything, but it's also about laymen. For example, even just not about arthritis, but even autoimmune diseases. So I would say like sports medicine and rehabilitation, we sort of like link together. We do help each other out, but the entities are different. For example, even now currently NCD, obesity, prescription, exercise prescription is being dealt with sports physician. But obviously there's a lot of interest being shown by rehab physicians in this area of expertise. For example, exercise prescription as well as even interventional pain. So even in Serdang at the moment, a lot of them have showed interest to come into exercise prescription. But nevertheless, like I said, you know, people are welcome. We do not sort of like have like a cut-off system, not to share knowledge, because I think everybody should sort of like help each other out. But sports medicine, maybe the sports rehab physician might not go so much into even sports coverage. But like what Dr. Ramani mentioned, it's just not sports coverage alone. It's very little, especially if you're KKM candidate. It's about 10 to 20% of your sports coverage. And most of it is your own interest outside of the work scope. 80% is basically what you deal in the hospital, what you deal by primary health centers being referred cases to. So yeah, so that's one of the difference in sports as well as rehabilitation medicine?
Okay, of course, there are a lot of, I think, same question also by Haris Hazwan. I think a lot of overlapping between sports medicine and rehab medicine. Actually, I think from the history-wise, sports medicine come from rehab, right? So of course, there are some overlapping area, but I think sports medicine, we are dealing more of return to play, and for sports, a rehab physician, they are dealing with return to function. So they are interplay in between that. So of course there will be some overlap. I guess that's concluded, not concluded. I think that's how the fine line that we can see return to function and return to play. Okay, question to Dr. Rahmani. UMMC has its own dedicated unit, meaning does it has its own MO service, or the MO are among postgraduate students only? If it is MO service MO, how to apply? How about the vacancy per se? So I think he want to apply for MO. Yeah.
Okay, interesting question. Basically, this human resource related question, they always ask how many patients per day you have in your clinic, how many patients per month in your clinic that require your clinic require more MOs, because now we already have those postgraduate MOs, about 10 of them per batch. They are working in our clinic, so we have currently so-called enough manpower to serve our patient in clinic, because roughly in UMMC sports medicine clinic we have like 70 to 80 patient per day. That one before COVID. After COVID, during this CMCO this time, we cut down into 50%. So you can imagine that we have 10 MOs serving while they are doing the rotational posting as well. So at one time, about 4 to 5 MOs already in the clinic, so we have enough manpower. But who knows, in the future, we need more. We need more in terms of expanding the services, and we are getting more patients. We are getting more referrals. Then we need more MOs. So if you are interested to apply as a UMMC MO, you can go to link mors.com, Medical Officer Recruiting System. So that's the special portal for UMMC staff recruitment. Okay.
Okay. Any more questions from the? I guess no more question, right? From the viewer. Okay. So thanks to Hart for the opportunity to introduce sports medicine program. So thanks to both our panelists, Dr. Rahmani and Dr. Malini. Both are actually very enthusiastic sports physician that will bring sports medicine forward after this. Okay, so I guess thanks to Hart again for this opportunity. So I guess we can, if no more question, I think we can stop here. Okay, thanks. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thanks organizer. Thanks all.
Yeah.
Yeah.
Okay, thanks, Dr. Malini.
Okay, Haswan, thank you so much for the opportunity. Take care.
Okay.